Howdy, everybody. We're just getting everybody into the webinar. So thank you so much. It's awesome to open it up and see well over 30, 40 people joining. So we anticipate we'll probably have at least 50, if not more, but I think we had over 100 registrants. So we'll give it just a couple seconds and we'll get rocking. All right. So hello, everyone. I think most everyone's from Colorado. So good morning still to everyone. Thanks so much for joining what is the session or second session of this series related to sustainability and looking at reimbursement and workforce strategies to help really promote and support the community health worker initiative, including patient navigation, Promotores de Salud, and a lot of the work that's really helping, I think what we've referred to on some instances as the care force throughout Colorado. I'm super excited because I think we're really delving in this series and understanding what are the opportunities as it relates to looking at reimbursement for CHW and navigation work, really thinking about who are the thought partners, helping really still, I think, provide some insight and information for the areas where there needs to be additional guidance. But just providing a really great level setting for what's happening for state level reimbursement strategies, as well as what's happening with some of our federal partners as well as even looking at, in addition from the public insurance space, what we have is possible opportunities for commercial and working at other type of reimbursement strategies. So really excited about this because the underpinning, of course, is looking at fair and equitable wages for people throughout the Colorado who are working to serve the medically underserved, particularly in Colorado. So on behalf of the statewide alliance, serving as one of the executive committee members, along with Elsa Staples, Nick Flattery, and several others who I think are joining today, as well as a host of folks who really support the effort. Our statewide alliance of community health workers, navigators, and promotores de Salud is excited to bring this series to everyone as our statewide kind of coalition of the work moving forward. And again, I think our main mission is really to think about the promotion of those policies, programs, and partnerships to reduce and eliminate barriers to quality and access to care within health systems and the community, really thinking about fostering health equity. And I think, again, a reminder that the Alliance believes that the Colorado and Coloradans have an equal opportunity in all parts of our state to obtain healthcare and need that personally address medical, dental, mental, emotional, social determinants, and spiritual health needs. So I'm really excited. What is now the first or the second of the series. We have an opportunity through this opportunity. We provided, again, that baseline setting for education, awareness, input. And then we're hoping that, of course, this fall webinar series then really does promote part of the fantastic work that can also then think about additional education, technical assistance that we're hoping to gear up an additional series after the holidays. So if you're joining today, thank you for joining in. Again, this is a second session. Last week had our first session, and Elsa can share a little bit about how to actually get in linkages to previous webinars, as well as then again, how to connect with a number of the resources that we're talking about. So we'll share that along. But just as a quick reminder, on October 23rd, coming up just in another week or two, we will be talking about the workforce development and training opportunities that are really, again, really cornerstone to a lot of the work that Elena and the healthcare policy team is going to be sharing about that reimbursement that Katie shared about last week, CMS, really thinking about that training and support and the development and how that really fits within this reimbursement strategy is going to be key. But we are also going to be really talking about what are some of those opportunities to linkages to resources for the workforce training moving forward. And then session 4, again, before the holiday season really kicks in. We're going to be talking about some of those, what we're calling performance-based quality payments, but oftentimes are even, I think, what are commonly known as bundled payment system opportunities for community health work and navigation support. And at that meeting, we're also going to be sharing some of the initial discussions that there have been had with commercial and private payers about the opportunity for reimbursement. So again, the whole idea is sustainability and really thinking about sustainability for this series. And then I'd really like to make a quick plug is that we will be shutting down the Community Health Worker, Patient Navigator, and Promotores Salud survey that the Alliance is conducting. And I think what we're really looking at here is, and it's an investment of at least 20 minutes for folks to go through this survey. But I think in Colorado, we are missing a good amount of data about who are serving in the roles, what are the specific areas and trends that we see as it relates to implementation, training, as well as the workforce needs moving forward. I have to tell you, there's not that many things that I would spend 20 or 30 minutes doing these days. But what I will tell you is that 5 of the you will at some point receive $100 even through Venmo for being a part of this process. But please, 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 on behalf of the the entire state, if you can spend time giving a sense of what's going on as it relates to this work, we really need this data because it will really help us continue, I think, thinking about sustainability and supporting the needs of our community health work and patient navigator community. We got this far by having this kind of data available for us. And so please, if you could do us a solid and take 20 minutes to do this, we would greatly appreciate it so we can say something definitively. I think we're just under 50 responses for this survey, but if we could get that up to 100, that feels great. I think about 10 years ago, we had a similar survey in the field and we had close to 300 responses. And again, that was really great data to help us understand what are the needs, the trends, and the direction we need to go. So I don't know what else I can say, but please, for all 70 of you who are on today, take that survey link because we'd really love to have that representation. And then, yes, Miss Ashley Wilson, that is a beautiful comment. We will put that link in the chat so everyone has access to it for all of my multitasking friends at home. That's also an opportunity, but please also share the link with partners and others who may not have this, and it will be as a reply in response to today. So you'll have that as well for those of you who registered. So with that, I'm going to turn it to Elsa, who's going to share a little bit more about the series, some polls. And then I just want to also say to Katie, who joined us, Katie Garfield from CMS and from the Harvard team, talking about all of the opportunities last time. Thank you so much. I don't know if Katie's joining today, but also in advance, thank you for the healthcare Colorado Department of Healthcare and Policy and Finance for really spending the time. And I have to tell you, I just want to say Elena, Morgan, that entire team have been amazing partners, really thinking about authentically what is needed in Colorado as we look about these reimbursement strategies, and there couldn't be better partners in this process. So also I'll punt to you and then we'll get underway with today's content.
Thank you, Andy, and thank you everyone for joining us today. As I'm running slides, I'll be a bit delayed in getting those links in the chat, but we will definitely get them in there, and they will also be included in the follow-up email that goes out to everyone who registered today. So really appreciate your time today. I'm really excited to build upon our session last week, which, as Andy noted, was focused on the new Medicare reimbursement that is available at the national level through CMS. But really today focusing on Medicaid and specifically what's coming in Colorado. And so we're really thrilled to have Elena Kelly joining us today, who's the Community Health Worker and Prevention Services Benefit and Policy Specialist with the Colorado Department of Healthcare Policy and Financing, fondly known as HCPF. And so this is really Elena's area of focus. She has been fully involved from start and will be going forward, really knows the details of all the design and implementation of this new Medicaid benefit for community health workers that will go live next year on July 1st, 2025. So there's been some recent new developments, and she has all the latest information. Really excited to have her here with her breadth of knowledge to share all of the information today. So before I turn it over to Elena, just similar to last week, we wanted to do a quick pulse check on kind of who all is joining us today, what areas you represent, and what you know about this new benefit. And so I am going to launch our poll questions in just a second. Before I launch them, please note there are 4 different poll questions that are all listed together. So you can scroll down with the little scroll bar on that pop-up that will show up in just a minute to go through the 4 questions. So please answer the 4 questions before you close out of the poll or submit your answers. So we'll give just a moment for that. But appreciate taking the time just to answer who's joining us today, what type of organization you represent, your role, where your organization is thinking about with this Medicaid benefit, as well as the training and credentialing program component that will be a prerequisite for reimbursement. And as everyone's answering the poll questions, just a couple of final housekeeping notes. We will send the recording and the slides from today's webinar in the follow-up email, and we'll also link to where the slides are and recording are located from last week's webinar, and include the registration for the next set of webinars. And then any other resources links that are shared today. And then you all are muted right now, but there will be plenty of time for discussion in our conversation today. So feel free to answer questions or ask questions in the chat throughout the presentation. And then there will be opportunity as well to come off mute to ask questions as we go into the discussion piece too. So I'm going to give it another 15 seconds since I still see a few responses coming in, and then we are going to go ahead and end our poll. All right. So it looks like today the majority of folks are representing community-based or nonprofit organizations, but we have a strong mix of all of the different types of clinical settings as well. So thank you all for joining us from your organizations. A good mix as well of those who are representing CHWs, Navigators, supervisors, as well as leadership and some of the finance groups from clinics and some others as well. And then very exciting to see that there are many folks, about a third, who are definitely planning on implementing the codes, as well as another third considering implementation, and some not yet sure. So this will be a great primer. And then lastly, a good number of individuals are already on the Colorado registry, which was the Health Navigator registry, now transitioned to the Community Health Worker Navigation Registry. And then some in the training process, others not yet completed the exam, but have been working on the training, and others who are not yet in that process. So again, this will be a good primer for that as well. Not getting as in depth with the training piece today, but we will be sharing a little bit of information. And also Becky Diorio from CDPHE, I believe, is on our webinar today. So good primer for next week as well. So thank you all for answering these questions. And without further ado, I am going to pass it off to Elena to get us started. Oh, and it looks like there are a couple of annotations that showed up on the slide. So I'll see if I can get rid of those, but we can go ahead and get started.
Yeah, so hi everyone, my name is Elena Kelly and I am the Community Health Worker and Prevention Services Benefit and Policy Specialist here at the Department of Healthcare Policy and Financing. And today I have the pleasure of sharing some new details regarding our Community Health Worker benefit for Health First Colorado. And almost, but really just the beginning of everything that you'll need to know to prepare for July 1st of 2025. Next slide, please. So here at the Department of Healthcare Policy and Financing, or HCPF, our mission is to improve the healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Next slide, please. And if you're not familiar with HCPF, or this is the first time that you are seeing us, HCPF is responsible for administering Health First Colorado, or Colorado's Medicaid program, Child Health Plan Plus, and other healthcare programs for Coloradans who qualify. And the next slide, please. So for today, as I mentioned, today is focused on almost everything that you'll need to know to prepare for July 1st of 2025. If you're new to the CHW Medicaid work, July 1st, 2025 is a key date for CHW reimbursement because that is the date that this benefit will be live for providers to begin billing for CHW services. For the agenda today, we are going to be walking through what we have been up to since the last time you might have seen us and where we're headed as we approach July of 2025. There will also be an opportunity for discussion on technical assistance for providers and Q&A at the end. I also want to note that everything that is included in today's presentation is the beginning of what providers will need to know in order to be able to bill come July 2025. And we plan on issuing additional guidance related to enrolling and billing in the spring of 2025. Additionally, this information will also be sent out via our newsletter today, so if you are not signed up for our newsletter, please sign up. That is the best way to stay up to date with all things CHWs and Medicaid. And Morgan is going to drop that link in the chat for the newsletter sign up. And so with that, let's move on to some background information about CHWs and Senate Bill 23-002. Next slide, please. So if you aren't familiar with the CHW Medicaid work, here is a bit of background on how the work started. Senate Bill 23-002 was passed in 2023 with bipartisan support and gave HCPF the authority to seek federal authorization from the Centers of Medicare and Medicaid, or CMS, by July 1st, for reimbursement from CMS to provide Medicaid reimbursement for CHW services. SB 23-002 compels HCPF to host public stakeholder meetings, seek federal authorization to reimburse for CHW services from CMS by July 1st of 2024, leverage the voluntary health Navigator registry that is currently housed within CDPHE, and launch the benefit on July 1st of 2025. We also have to report back to the legislature about the benefit by January 31st of 2026. If you are interested in reading the legislation, Morgan dropped the link in the chat for me, and that has all of the details that I have just explained. Next slide, please. So really quickly, I just want to highlight this here. So for the definition of the CHW, HCPF has aligned with the APHA definition that is listed on this slide. But something I want to highlight that is unique to Colorado is that we are using the term community health worker as an umbrella term, and recognizing that though the titles may vary, such as like a health navigator, promotora, community outreach worker, the duties are likely going to be similar. And we're just recognizing that community health worker is an umbrella term. Next slide, please. So if you have been connected to this work, this is probably, you've probably seen this graphic before, but this is a really high level of the project. And as I mentioned earlier, this came out of a piece of legislation that was passed in 2023. So from May of 2023 to February of 2024, we focused on research and development, which included our stakeholder engagement period. And I'll talk more about those details here in a minute. From February of 2024 to July of 2024, we continued to meet with stakeholders one-on-one, but we also met with other states that have current CHW reimbursement to learn more about how their CHWs function within their Medicaid systems. During this time, we also submitted to CMS for federal approval. Now we are shifting into implementation of this work, and I'll talk more about the implementation details in a few slides. Next slide, please. So the last time you probably saw us, we were deep in stakeholder engagement, and that was at the beginning of 2024, which is really hard to believe. And so now we're really shifting into getting this benefit off the ground. So before we get into that, I want to highlight our stakeholder engagement piece. So next slide, please. I want to take a moment to highlight this because we were really successful in being able to share this new benefit with stakeholders and also be able to learn more about how CHWs are working within Colorado. During our engagement period, we were able to reach 98 organizations that were represented from all across the state, and we also had an average of 130 attendees at each of the meetings. Not only did we host the 4 stakeholder webinars back in January and February, but we also opened up a feedback form with questions. We also presented at a few organization meetings and met one-on-one with organizations. If you're interested in that content that was presented during our stakeholder engagement sessions and the feedback that we received, please check out our stakeholder findings report. It's a really good comprehensive report that we put together to highlight all of the information that we collected during that time. And that should be in the chat as well. Next slide, please. So you're probably asking, well, what's new and what has changed and what is next? And so this next section of the presentation is really focused on where HCPF is currently at with CHW implementation. Next slide, please. So as I mentioned, we had to go to CMS to get approval for our state plan amendment or our SPA. And so I'm really excited to announce for the first time publicly that our SPA was approved just a couple weeks ago. And so now we can kind of shift into this implementation of the new benefit. But at a high level, I want to cover what we put in the SPA because we got a lot of questions about the language that we included. And so at a high level, the SPA document included service definitions and then the provider qualifications. And so these next few slides will cover exactly what was covered in those pages. A lot of you were also interested in the document itself. So if you are interested, Morgan has just placed that link in the chat for me. And this SPA will also have a home on our webpage here in the coming days as well. Next slide, please. So here are the service definitions, and I know this is a lot of text, so please don't feel like you have to absorb all of this today, but this slide just covers the service definitions. And so the first row is the 3 areas or 3 service umbrellas that will be allowed to be reimbursed by Health First Colorado. And those areas include health system navigation and resource coordination, health promotion and health coaching, and health education and training. The second row includes definitions that were approved by CMS, and the third row are some potential examples that could fall into each category. If you attended our stakeholder webinars earlier this year, you'll notice that these definitions really didn't change from what we presented to you all And so with that, I'll read the definitions to you all so you have a better understanding of what the service definitions include. So bear with me while I read this. I know it's a lot, but I think it's really important that you all have this information. So I'll start with health system navigation and resource coordination. So this includes helping to engage, re-engage, or ensure member-led follow-up in primary care, routine preventative care, adherence to treatment plans, and/or self-management of chronic conditions, including assisting beneficiaries to access covered services and other community resources necessary to promote health, address healthcare barriers, and health-related social needs. Moving on to health promotion and health coaching, provides information and training to a member that enables them to make positive contributions to their health status. Health promotion and coaching includes screening for health-related social needs and setting goals and creating an action plan and providing information and/or coaching. And lastly, for health education and training, train and/or increase the members' awareness of methods and measures that have been proven effective in avoiding illness and/or lessening its effects. The content of the education must be consistent with established or recognized healthcare standards. So next slide, please. So this was the second part of the SPA, and it included the provider qualifications. And so this slide shows a really high level overview, but again, I'll read the SPA language for you so you can have a good idea of what each one means. So for that first one in purple, for credentialing, community health workers are required to obtain credentialing through the Colorado Department of Public Health and Environment, or CDPHE. Credentialing includes mastery of the following core competencies: community assessment, engagement and capacity building, individual assessment and advocacy, effective communication, cultural responsiveness and mediation, education to promote healthy behavior change, care coordination, use of public health concepts and approaches, and professional skills and conduct. So for that second bar there, for the training and registry, so to receive a community health worker credential and be placed on the CDPHE Community Health Worker Registry, an individual must participate in a CDPHE recognized community health worker training program and complete and pass the state community health worker assessment. Additionally, we have included the tribal community into this benefit. And so for some background for you all, tribal communities often refer to their CHWs as community health representatives, or CHRs. And so the following language applies to their qualifications. So community health representatives are to obtain credentials suitable to their tribal CHR requirements. Next slide, please. So you're probably asking yourself, well, what about care coordination and working with the RAIs? So we've been getting a lot of questions about this too. So HCPF has announced the new RAIs, and pending any protest, HCPF will begin to finalize and execute those new contracts. Unfortunately, today I don't have specifics on what this looks like for CHWs, but if you are interested in reading the RFP language, the link to that RFP is in the chat. And then sections 7 and 8 include the CHW language. Again, once we have a better idea of how CHWs and the RAIs will look and how that process looks for you all, we'll be sure to release additional guidance. So I know that was a lot of information. I want to stop here and see if there's any questions, comments, or any concerns. Yeah, Mary, go ahead.
Hi, I know that in conversations and stakeholder meetings, we've talked about folks who are working as community health workers but are not currently designated, and that we thought there might be some way for workers to test into the credential. Is that still under consideration, or has that been rejected?
So that's a CDPHE question. I don't know, Becky, if you want to come off mute, you can. Otherwise, I would probably just direct Mary to maybe contact you offline. Totally
Yeah,
up to you, Becky.
I can speak to this. Can you hear me? Yeah.
Yeah.
As of right now, for the credential pathways, there is not a work experience pathway, but we are developing one. So it will be 2,000 hours of experience, which is roughly a 1-year, job, half of which can be volunteer experience. So it doesn't necessarily have to be like paid employment, that full 2,000 hours. And there's going to have to be documentation that attests to how the work experience is relevant to the 8 core competencies. And so that is all under development right now. That pathway is not currently available, but we're in the process of that. And we are aligning with HCPF to make sure that that pathway is allowable and accepted under the credentialing requirement.
Do you have a target date for when you think you'll roll that out?
It's a good question. It's kind of dependent on a couple of things. And I can turn my video on so you can see me as I'm talking. So we are also rolling out a new registry through Certimi, and that won't be available probably until about January 2025. Through that platform, we are developing this work experience pathway. So I would say at a minimum, not until January. The complicating factor is that individuals who go through the work experience pathway will also have to complete the assessment. So we are also in the process of developing a new written assessment based on the new CHW competencies. Individuals who go through CHW training would ultimately complete that written assessment. It probably won't be available until June of 25. So an individual going through the work experience pathway could take the current assessment, which is the in-person or online scenario-based interacting with a actor assessment, or they could wait for the new assessment. So we anticipate that the application should be available like early 2025, but it's going to depend on the individual's preference if they want to take the current Health Navigator assessment or wait until the written assessment is available. Does that make sense?
Yes, thank you.
Yep.
Thanks, Becky. Angie, you have your hand up.
Hi, thank you. I'm Angie Goodger. I work at the Department of Public Health and Environment in our Children and Youth with Special Health Care Needs section. And I just want to make sure that I'm putting this all together, because at the beginning, Elena, you said that that the CHW is sort of an umbrella with the navigation and the different components. Later then we said, but they need to be on the registry, which means they've taken courses and passed the test for CHW. So I heard those two things, which felt a little bit like contradictory. And yet then I heard, but we're going to have this new pathway. So maybe people who have been navigators can take this test. So I just want to make sure, I'm hearing that all kind of how it's laying out. It's just because it's sort of an evolving process. Does that sound right?
Yeah, so I think so you're hearing it all right. So I think traditionally in the past, especially with like the navigator, you probably heard me say health navigator. Up until this moment and this like shift towards like the community health worker language, this workforce has really been referred to as like a health navigator. And so what we're doing is we're essentially saying, okay, we recognize that everybody has used different terms at some point in the past, but now we're shifting towards using the term community health work. And so it's all going to be recognized. So try not to get too much like caught up in the verbiage. What we're trying to do is shift into this new community health worker verbiage, I guess, if that helps.
And
Thank
Elena, I
you.
think you make
That
it.
does help.
Okay, yeah, and I know Becky's on and many of us who've been involved, but the initiative, yeah, like the umbrella term, but it doesn't take away from people who are the nomenclature calling themselves navigators. There's the community health work, and so the auspice, it's like underneath that umbrella. So I think that's one of the things we've been really talking about, but it's a good distinction because I think, as you said, Elena, it's a movement and it's a shift. But I will tell you, I think many of the states have been most successful in driving policy and driving these sort of initiatives for sustainability. It's really being making sure that CHW component is under, that has that umbrella. So I just want to say that I think this is a good shift. And then I know on the state health department, and I know Becky is the fearless leader of moving that initiative forward, has a nice layout of also how that initiative is coming to bear. And so we can share that as well. But thank you, Elena, and we'll try to make sure that that's really represented and clear to folks as we move forward with the Alliance, the state health department work and the like. So thank you, guys.
Yeah, absolutely. Thank you for that, Andy. Okay. Are there any other questions before we move forward?
I put a question in the chat.
Okay.
Please look
Let's
at
see
it.
here. So the question is, does individuals have to be enrolled in Medicaid to receive reimbursement, or can it be an uninsured individual in clinic or the community? Hold tight on your question. I have a slide coming up, so hold tight. But it is a good question, and if I don't answer it, please put it back in there. But hold tight. We have a slide coming up on that. Okay, so let's go ahead and move forward. Next slide, please. So kind of shifting gears here, I want to talk a little bit about the procedure codes that we are thinking about opening up, ones that we're still deciding on, and then ones that we are not going to be open. So I'll start with the proposed ones for CHWs. And I realize now that this might be a little small for you all to read, so my apologies on this. But so the codes on the procedure codes on the slide are the proposed CHW codes that we are thinking about opening. And so these codes include the self-management education codes, preventive medicine counseling codes, which are known as the vaccine hesitancy counseling procedure codes, and then the screening brief intervention and referral to treatment, or our SBIRT program. So the preventive medicine codes, medicine counseling, and the SBIRT program procedure codes are currently open on our fee schedule. And if you're interested in the reimbursement rate for those procedure codes, please check out our fee schedule, which will be linked in the chat. Something else that came up during the last session was regarding copays and cost sharing. So I just want to kind of highlight that, since that was something that came up. HCPF has recently updated its copay policy, and HCPF only has copays for non-emergent use of the emergency room. Also, there'll be no cost sharing or copays for CHW services. And if you're interested in learning more about that policy, it looks like Morgan has just placed that in the chat. Next slide, please. So this slide covers the codes that we're still discussing and the codes that we will not be opening. So I'll start with the ones that we're still discussing. So the first one is the smoking and tobacco cessation. So this is a code that is currently open on HCPF's fee schedule, but it pays at a low rate, like $12.50. So CHWs would still be able to provide smoking and tobacco cessation services and receive reimbursement for those services under the self-management education procedure codes. So with that, we are in the process of working with our rates team to determine the reimbursement rate for self-management education codes. And the outcome of that rate will determine whether or not we open up these smoking and tobacco cessation codes. On the other side, kind of flipping gears here to the Medicare codes that were talked about during the last session, we are looking at opening up the social determinants of health risk assessment code, but I want you all to be aware of the current guidance of this code, just as an FYI. Currently, this procedure code can only be performed at an evaluation slash management visit, an annual well visit, or a behavioral health office visit. As you may imagine, this is pretty limiting to the work that CHWs do, especially when the member is not already connected to the health system. But on the kind of the good news, or hopefully good news, is that there should be updated guidance that comes out from CMS that could change the current guidance. But in the event that that guidance doesn't change, I want to just make you all aware of the current guidance, as this does limit where it can be provided. So shifting gears over to the other Medicare codes, these are codes that are Medicare codes. I won't spend too much time going over what these codes are since that information was covered during our last webinar session, but I do want to explain why we are not including the other Medicare codes for CHW Medicaid services. The CHI procedure codes, which is that first box in purple, are very similar to the self-management education codes and the services that the RAIs provide. Because of the crossover, we are leaving the CHI procedure codes off and opening up the self-management education codes. Additionally, we will provide guidance for working with the RAIs for care coordination related services. Similar to the CHI services, PIN services or PIN services would also be covered under the self-management education code, but the PIN-PS services, which is that kind of the second part to that second box there, are specific to peer support specialists, and that is covered under our behavioral health capitation. I want to note that we try to align with Medicare whenever it makes sense, but we really believe that the self-management education codes serve as the best option for CHW services in Medicaid. I also want to note that this decision is for Colorado Medicaid only. If you are providing services to Medicare beneficiaries, you may still be able to use these codes for reimbursement. I'm sure there are some questions, so I'll stop here and provide an opportunity for any questions if there are any.
I do see one question in the chat from Darlene, which is asking about a cheat sheet of codes.
Yeah, so this will be put once we kind of finalize all of this information and decide specifically about the codes in blue here on this slide. We'll include this in our billing guidance, of course, and then I could assume that if you all would like a code cheat sheet, like a one-pager, I think that we could probably put something like that together too, but at the minimum, it will definitely be included in our billing manual, which I'll talk about here in just a little bit.
And just as a quick up, I think, oh yeah, a code sheet would be great. Thank you, Darlene. That was a great comment. If, I know hopefully Elena and Elsa and Morgan are looking to, if for some reason we're not seeing a hand, because I know that there are folks that are also, on, just make sure and either pipe up or add something in the comments. So, Stan had a question is why is SDOH assessment limited to annual well visits, versus the need is yet, for severe illness? Sorry, I have a pop. Oh, need is, since the need is year round and severe illness, Elena.
Yeah, that's a good question, and I don't know if I have a good answer for you. Really, so I think I don't have a good answer for you. I think it's just the guidance that Medicare has. And Morgan, please feel free to jump in if you know something that is better, that you have a better answer for this. But I don't have a good answer as to why it's limited to just the annual well visit.
No, I think Elena, you're right. It's Medicare's guidance right now on the code, and they run their program just a little different than the state Medicaid programs tend to run. I think the reason they're asking for feedback though right now is because they may be seeing some barriers with how this code is described, having to be part of an annual well visit or office visit. So we're hopeful that updated guidance comes out so that the code description kind of matches where we hope the services can be provided. But TBD, no extra insight. Elena, you had a great response.
All right, I'm not seeing any other questions, so I think we can go ahead and move on to the next slide, please. So you're probably wondering, okay, this is all really great information and the SPA's approved, but what's next? And that is a very great question to have. So now that we have the SPA approved, we can really start working towards implementing the benefit. So this includes things like policy decisions, systems updates to our systems, approaching the medical services board, and planning for technical assistance. Next slide, please. So this is kind of a zoomed in timeline. And so this is going to be kind of the timeline that you'll start to see as we move forward throughout the rest of this year and into next year as well. So this gives you a better idea kind of at a high level of what the next 9 months look like. So I'll kind of break this down into two periods. So I'll start with between now and the end of 2024. So between now and the end of the year, we're going to be making updates to our FAQ document that we put out at the beginning of the summer, as well as posting the SPA to our webpage. Additionally, we are going to be creating a benefit fact sheet that covers a lot of the high-level information of CHWs and Colorado Medicaid. Additionally, like you just saw, we have some remaining decisions to make, with things like the procedure codes, place of services, limitations to the benefit and non-covered services. And then shifting into 2025, so that next set of boxes there, we are planning to begin our system updates in preparation for our new provider type. Excuse me. And I'll talk about that more on the next slide. Additionally, we will also be going to the Medical Services Board, or MSB, in March for the final policy adoption, as well as supervision changes. This will be an opportunity for you all to provide public testimony on the final policy and the supervision changes. And then lastly, is the technical assistance, and this is something that we are planning for to ensure that you all have the resources that you need to not only enroll as a provider, but also successfully bill once services once the benefit is live. This is also an opportunity for stakeholders to provide feedback today. And moving forward, if you think of a suggestion or you see something that you think might be helpful for you, please send it our way. We are very open to feedback and suggestions within the technical assistance kind of landscape. Next slide, please. So as I mentioned on the last slide, there will be a new provider type for CHWs. This was an item that was included in Senate Bill 23-002 for HCPF to look into as an avenue to include organizations that are outside of the traditional healthcare setting, such as community-based organizations. So this is something that we're currently exploring. And so what this means is that all CHW services would be reimbursed through the new CHW agency provider type. Individual CHWs would still need to affiliate with a CHW agency enrollment. Claims would be submitted directly to HCPF through our provider portal. I have this linked here to kind of give you an idea of what this looks like. But I don't think you can get in because I think you need a login. So just keep that in mind. And then collaboration with claims would be submitted. Okay, so then collaboration with referring clinics or practices would need to occur to ensure that the member's medical record is being updated. I know that this is a kind of a lot, so I want to stop here and see if there are any questions, comments, or thoughts on this new provider type.
Elena, this is Andy, and one of my questions was that and again, if you've said this, but in my pea brain, I've been having a hard time like thinking a little bit. I love the opportunity that this might afford CBOs, right, to look at an opportunity to reimburse. And I think it's one thing that we were really excited about. But can you tell me this? So in the CMS ruling, right, which we're moving, I know you're talking Medicaid, but in CMS, they are billing under the opportunity for bill for these services would still be under the physician fee schedule, right? And so that's the PFS. So if this new provider type was open, that would just be from Medicaid, but it wouldn't be like a provider. Would they be eligible? So for instance, if someone was, a CHW or PN, even with Medicare, by opening this up, did this give opportunity that wouldn't have to be under the purview? Or is this only for Medicaid specific? You wouldn't have to bill under the license or under the auspices of like an advanced practice or a DO or MD. Does that make sense?
Yes, so I think I'm following. So the CHW would still have to have their services recommended by what we call as a licensed provider of the healing arts. And so we're still working on that terminology of what is a licensed provider of the healing arts, right? Because it's not defined in our state, on our legislation or in our state plan. And so TBD on what that list looks like, but you can imagine it'll have like a physician and that kind of thing. And hopefully we'll be able to expand that to also include like social workers and that kind of thing. But this is specific only to Medicaid and Colorado Medicaid. I will say that when we talk to other states during like our research and development phase, a lot of them also did the same thing. It's really the easiest way to like evaluate. On the evaluation side, it's really the best way to evaluate the benefit to see who's using the CHW services, but also the cleanest way for hospitals, clinics, FQHCs, that kind of thing. Does that answer your question, Andy?
Yeah, kind of, but it sounds like that there's still some precedent that has to be set right around that language. Okay.
Yeah.
Yep. So Monica's question is, I want to further advocate for reconsidering this visit type and follow up on the social needs and codes. Needs or education identified in chronic disease management appointments by specialists should be considered. This is especially true in pediatrics. So Elena, do you have any other comments or feedback?
No, I think, yeah, I agree. I mean, we're really trying. Well, I want to further advocate for reconsidering the visit type. Oh, for Monica, are you referring to the SDOH code? I think so.
And Monica, if you want to come off mute, feel free and we can have a chat.
Oh, okay. I didn't know whether I was allowed to do that. Yeah, I guess I'm actually, if social needs, and actually I don't, if you mentioned about self-management, if that has to be associated with a well child check or kind of more specifically with primary care, so much disease management in pediatrics, at least around diabetes, around, I mean, I don't even cancer care or transplant care, or so much of that happens in the specialty office, rehab, cystic fibrosis. I mean, there's so many things that happen. And so if those codes can only be dropped by primary care, where really they may not recognize the need until the child is pretty sick and managed by a specialist, it's going to be a barrier to delivering those cares, or to having people to paying people to deliver those cares when they've been identified, or the barriers to care that have been identified.
Yeah, no, I hear you on that one. So the just to clarify, the requirement is just for the SDOH Medicare code. That's the only requirement that has like a setting specific requirement. The other ones, I believe, don't. Specifically, the self-management education codes don't have a place of service limitation like that SDOH one. So just to clarify that, but I hear you. I'm all for being able to administer that test, that assessment before the person is connected to the healthcare setting. So I totally hear you there. Let's see here. So Mary says, for existing provider types, we are in LPHA. Will we need to add a new agency type? Yes, so new and existing provider types will have to enroll and add this additional enrollment type to their existing enrollment as well. So yes. I'm not sure who was first. I think Hannah was, and then I'll go to Julia.
So actually, my question was already answered by Mary, so thank you.
Okay, there you go. Julia.
Great, good morning. Or afternoon. I just had a question because we're working with the community, with Colorado Access, we're working with our community organization partners. And I'm sorry if I'm confused here. My understanding previously was that there had to be medically necessary documentation through providers, but that the providers would need to oversee the care through CHW services. Is that still in place? This new provider type seems to be that the community organizations, once the members are deemed medically necessary, they can bill directly to HCPF and don't necessarily have to go through the providers. Is that correct? Am I confused?
So I think you're referring to the supervision. And so that is still the case, that they still will need to be supervised. Who that list is, that's what I was referring to. We'll see what the supervision looks like. And that's part of on that last slide that I was talking about the supervision requirements. We heard from you all during our stakeholder engagement session that you were very against having direct supervision. So that's still the case. The supervision will still be there, but we'll have to go to our medical services board to get that addressed and figured out. So TBD on that, but that would be a really great opportunity to advocate one way or another on the supervision requirements. And so to address your comment about the medical necessity and the documentation, that is still going to be a requirement. I don't have it included here because we're still working out the specifics of that and what that looks like, but we'll provide additional guidance once we have all of that finalized.
Thank you.
Yeah.
So Elena, let me break it down digitally. I think okay, let's say that I'm a CBO, right? And I have people who've gone through the channels for the training, and we have a credential, and we've gone through that process. Now, if this new provider type is something that goes forward, and I'm someone who's on the registry, I've gone through all of these pieces, Elena, there's a chance in supervision, right, that can those people be, I don't know, I think it's football season, but like free agents, right? Like, will you have to show a line of supervision to someone theoretically, or what other states have done? Or is it even possible that community health workers and navigators could just be a standalone provider type? Will there always have to be a link to another supervisor of sort? Does that make sense?
Yeah, I think I'm following your question, but I might have Morgan answer because she's better at this like technical stuff than I am.
You're doing
So
great,
Morgan.
Yeah, so I think sometimes it's easy to kind of cross the wires of like needing to be ordered by versus supervised by. And so CHW services do have to be ordered by a licensed provider. That's what
Okay,
Elena
and
was
so
talking
Morgan,
about
that will
with-
never change. That is
Yeah,
not,
that's in
not, okay.
federal regulation. Yep.
Okay,
We can't
that's
change
what it
that.
is.
Yep.
Okay.
Yeah. And but what we are considering and what we hope to take to our medical services board is once the services are ordered by a licensed provider, do they have to be supervised and at what level? And so that is what we are still working on internally, and we hope to take to the medical services board probably this spring. And that's what we would love if people want to attend those meetings. Once we know them, we're going to put this information in our newsletter and on our website of like, how can we update the language in the Colorado Code of Regulations. We call it CCR, or rule for short, and that's what our medical services board helps us amend that language of what supervision level is required when a CHW is providing services. So that's kind of what we're trying to figure out still, and we were hoping to kind of go before MSB in the spring. So does that help?
Yep. And I think, Elena, you said it, and I just needed to like probably process for a little bit. Okay, got it.
Yeah, and I just want to, I think I saw a comment from Stanley further up in the chat, and I think we kind of lost sight of it, so I was going to read it now, Elena, for you.
Yeah, go ahead.
Stanley asked, could the new provider potentially include school districts or school-based health clinics to utilize this resource, or will all of this be coordinated through Array?
Yeah, so this is a great question. So in terms of place of service, we don't want to limit this at all. So I believe I have schools, and I would have to check on the school-based clinic one. But again, thank you for bringing that to my attention because I think we might have left that one off. But yeah, so this new provider would include the school districts, and we'd have to check on the school-based health clinics. But yeah. Okay, so I saw some other comments here. Megan, can multiple providers have approval to use these codes/rules with the same patient? So there will be limits on like how often the code can be used or how often the code can be billed. So like for instance, I'll use the social determinants of health code. One of the limits is that it can only be used every 6 months. So in that situation, you would only be able to build the code every 6 months for that. And then I see, so Megan has another question about will they need a PAR? So we're not going to do any PARs or anything like that. And so what this kind of speaks to is our limits. And so we're still finalizing these details. But essentially, I think what we're going to end up doing is having a daily limit and then a monthly limit. And those were informed by you all during our stakeholder engagement session. So I think what we're going to do for the daily limit is the max of 2 hours a day. And then the monthly limit we're still deciding on. So stay tuned for that. And then the other question, if a patient is not approved, Morgan, can you read her last question? The bubble
Yeah.
is like in the way.
Yeah, so the last question is, if a patient is not yet approved for Medicaid, is there thought around how these codes can be used to support the patient process of getting assistance with qualification of Medicaid? You want me to chime in?
Yes, please.
Yeah, so we had some good discussions with CMS about this, because this came up a lot during stakeholdering. Can CHWs be reimbursed for enrolling individuals in Medicaid? CMS is pretty clear the answer is no, that they have the way we are funding our counties to do enrollment and our medical enrollment sites. That is the process for getting someone enrolled in Medicaid. They are hoping to provide us with some additional guidance on what it means to help people navigate the general programs that exist for addressing the social determinants of health. And so that's it's like a similar but a different vein of like, well, what about SNAP and WIC enrollment and things like that? We are still waiting for that guidance specifically from CMS, but they've been pretty clear that if someone is not already on Medicaid, our reimbursement for CHWs via Medicaid can't be used for that process. So hopefully that helps answer that question, Megan.
Yeah, thank you, Morgan. I'm going to move on because we're kind of short on time and I still have a little bit of content to go through with you guys. So bear with me. I'm going to kind of speed through these last couple slides. So you're probably thinking to yourself, well, what should I be doing? And so I don't have good news for you. We have to wait. But right now, really the best way to prepare for CHW reimbursement is to first make sure that you are signed up for an approved training and ready to take the state assessment. If you have questions about the training, assessment, or the registry, you can either visit CDPHE's CHW Workforce Development webpage or contact Becky Diorio. Morgan will put both of those links in the chat for you all. On the HCPF side, like I said, we just have to wait. Unfortunately, I don't like waiting as much as you guys do, but this is kind of where we're at. And so we just have to wait for our systems updates to be completed before CHWs can begin enrolling with us. If all goes to plan, though, we are anticipating that we could begin enrolling providers as soon as mid-spring of 2025, which is really exciting. So you won't have to wait until July to enroll with us. As soon as we have it available, we'll make sure to push that all out via our newsletter. I know I've said this a million times, but that is really the best way for us to get this information out to you. So even if you're unsure if you're going to leverage this opportunity of reimbursement, I really encourage you to sign up for the newsletter. Additionally, we'll also continue to be available for questions and one-on-one meetings. And so please, if any questions come up, please email us. We're happy to help however we can. Next slide, please. So we're going to kind of shift gears here into technical assistance and a discussion, hopefully. But this is something that we're really trying to be thoughtful of because we know a lot of you have never billed or worked with Medicaid before. And so this includes leveraging existing resources that HCPF has for our existing providers, but also thinking about creating new ones as well. Next slide, please. So this first section here is just about the assistance that we currently have available right now available on our website for all of our providers. So the first link here on this slide is our home base for everything provider related. And then the second one is our provider resources main page. So this includes resources for enrollment, trainings, quick guides, things like that. And then the third one is our provider enrollment resources. And so this is everything that you need to enroll as a provider with HCPF. And within that is also our provider enrollment manual. And this is a step-by-step guide for enrolling as a provider, which also includes screenshots to help walk you through that process. Next slide, please. And we also do offer live trainings for providers, and these are all held via webinar on Zoom, and the registration links can be found on our provider training webpage. And Morgan is dropping all of these links in the chat for you all. Next slide, please. So this is the overview of all of our trainings that we currently offer. So our first one is our provider enrollment training, and this is designed for providers that are at various stages of the enrollment process with Health First Colorado. This training provides an overview of the Medicaid program and guidance on the provider application process, common errors, and then enrollment types. Our second set of trainings, they're in green, are for billing, and so these trainings include a high-level overview of member eligibility, submitting claims, navigating the department's website, and using the provider web portal. And there are beginning and intermediate trainings that are offered. The last set of trainings that's technically not up and running yet, but is something that we're thinking about creating for CHW services. And this is referred to as like a CHW specific training. And so we have these for our existing provider types. Well, some of them we do. But this training includes an overview of CHWs, the enrollment requirements, and then the billing information. And so this is something that we want to gauge if there's interest in, and if there is interest in, we'll start working with our provider training team to start getting that content developed so we can hopefully be able to provide that in the spring before the benefit goes live for you all. So before moving on, I'll actually go ahead and go to the next slide, Elsa, please. So this next section is what we have planned. So I mentioned the billing manual earlier. This is a traditional HCPF billing manual. So the content that is included in that depends on the benefit. So we have these for our existing benefits, but generally you can expect these kind of high-level topics to be covered. So we have general benefit policies, billing information such as procedure codes, diagnosis codes, and place of services. And then benefit limitations and timely filing. If you are interested in checking out the billing codes that we do currently have, Morgan, it looks like, has dropped that link in the chat. And all of the ones that are somewhat similar to CHW services, but they probably very different too, are under the CMS 1500 professional dropdown. Next slide, please. Also, we have a toolkit that we want to push out for CHW reimbursement. And so this document is something that we're taking inspiration from other documents, such as from the New Mexico Office of Community Health Workers, who also have recently implemented CHW Medicaid reimbursement, and then our Diabetes Self-Management Education and Support Reimbursement Toolkit that we partnered with CDPHE on. And so this document at a high level could include topics like an introduction, key concepts, glossary, CHW scope of work, and credentialing, steps for becoming a Medicaid reimbursable CHW, and billing and reimbursement limitations. So if you are interested in checking out those two that I had just referenced, Morgan has dropped those in the chat as well. Next slide, please. So we only have a little bit left, but I want to make sure we are able to hear from you all. So now that you've seen what we have available and what we have planned, I'll open it up to you all. I know we mentioned the code cheat sheet earlier, but what else would be helpful to you in regards to technical assistance? And I'll pose the question, if you had a wish list, no thought is too small, please be big with this. But if you had a wish list for TA for CHW services, what would be on it?
Elena, while people are thinking about that, I think there was another comment or question, and I think I dropped it in. How long does the process take, or when do you recommend organizations start this process if you want to start billing July 1st?
Yeah, so I don't have a good answer right now because we just don't know when the enrollment will be available. And maybe Morgan has more insight because she deals more with the enrollment piece of it. Morgan, do you know?
I'm sure we have like a general timeline. I will say it probably depends on like the complete enrollment package that's submitted to us. And if we have any questions or back and forth, it can probably delay. I bet you we can probably find a general timeline of how long it takes to enroll with HCPF, and we can put that in some of our guidance or fact sheets, especially once we have the provider type created and can open it up for enrollment.
Yeah, absolutely.
Elena, the one thing I would say is, I do think the cheat sheets that have been mentioned, I love that you have all of these. I think there was some kudos and some love to you guys for the beginner toolkit. From the Alliance side, I think one of the things we might want to do is maybe have like a monthly update, like the inside corner from HICPUF about what those resources tools are, and then continue to get that out and then linking back to you. So just so I don't forget to say that, that's probably something we will do. And one thing I will remind everybody, I think on some, or just say, just to Morgan and Elena, I think I'm reminded that a lot of people still don't really know what's happening. And so I think maybe if we can keep a cycle of a reminder, this is what this is what it looks like, just to keep the drumbeat going of awareness. That's one of the things I think I just want to put out there, but I'll be quiet and let others chime in too and see if anything's coming in the chat.
Yeah, so Laura put a comment in the chat. It would be helpful to know basics like how long payments take for reimbursement. I think we have this guidance somewhere. I just need to find what document it's in. So Laura, if you would like, you can shoot us an email and I can find this for you offline so you have this information. But we can also plan on publishing it into our FAQ or our guidance or some document that it'll fit in. So there's another question from Jerry. Will CHW who are on the registry but working in the community be able to receive Medicare reimbursement when helping individuals? Jerry, are you referring to Medicaid reimbursement? You typed Medicare, so I just want to make sure that I can't speak for Medicare, so I just want to make sure that I answer your question properly.
Medicare.
So I can't speak.
I used the wrong word. It's Medicaid.
Oh, so you meant Medicaid.
Yes.
Okay. So the question is, will CHWs who are on the registry but working in the community be able to receive Medicaid reimbursement when helping individuals? So if they are tied to the agency that they're representing, so and they're in the community, they should be able to, as long as they're on that registry, yeah. And then Laura has another question. And what are the error rates what the error rates are as small community-based organizations have already paid staff? Morgan, do we
Might be about
have?
like claim denial. I'm
Oh,
guessing,
okay.
Laura, but feel free to like come off mute.
Yeah,
if that's
exactly.
right. Are you asking like error rates and claims?
Yeah, exactly. So in my head, at least we're very new to this, so we have to pay our staff, obviously, and so we're just trying to get a sense of how long does it take the state to pay this back? What are the error rates so that we're planning cash? Because we now are, if we pursue this, will be it will be a reimbursement model, obviously, for us. So how many months worth of cash do we need to have in order to pay staff to do this? And then what's the error rate? So if 90% get paid in 30 days and 80% get paid in 45, whatever all of that looks like.
Yeah, we can definitely find the exact dates. I know at a high level, like we run our payment cycles at least once, if not twice a week, to pay claims that have come in. So we have a pretty fast turnaround sometimes compared to other payers where about once or twice a week our payments are going out for claims that have been adjudicated in our system and have hit all the appropriate check marks saying all the right boxes were filled and the provider was enrolled on the date of service, etc. But we can find the exact dates and make sure we put that in some of our guidance of like how quickly we turn out payments and what, especially once we start to see claims, what some of the common errors are and how can we help address that.
Yep.
Yeah, absolutely. Good point. Okay, so does the CHW reimbursement, oh my gosh, does this CHW reimbursement apply to individuals who have Denver Health Medicaid plans? Morgan, correct me if I'm wrong, but I believe the answer is yes, right?
Yes, we're going to make this a statewide benefit. I will say we are still figuring out how to incorporate CHWs into the managed care rates that we pay them. And so they might ultimately be like fee for service in our managed care plans before we incorporate them into the managed care rates, but they will be covered under Denver Health Medicaid and if you're out on the Western Slope, our Rocky Mountain Health Plans Prime is also a fully capitated program. CHW service will be under those two.
And it looks like we have a couple suggestions, but we'll end here with the final question from Ashley. What time frame is the 2,000 hours of experience this past year or past 3 years, or another time frame, I think?
I am looking that up and I will get the exact language in the chat.
Okay, cool. And then
Thank
Hannah's
you.
comment, I'd love to see a group regular meeting created for those going through this process. I know with our LPHA, we have worked closely. Would love to see a cross collaboration. And those who are not billing regularly, and an implementation checklist flow for different types of organization and staff. I would also say, I think this is consistent. I was thinking a little bit about like case studies, maybe on some level of implementer, and what some of those common issues you might see in terms of looking at that support. Becky, I see your name pop up, not a picture, but the name Becky. Did you have a question before we close out? Are you good?
Me?
Yep.
No, I'm good. I'm just, but probably because when I talked earlier, sorry, I'm gonna get the work experience pathway language in the chat. That was all.
Okay, cool. And then I think, Elena, was there anything else? And Morgan, you wanted to finish out with anything else? I know that you were looking at a few other things.
Yeah, the last thing I would say is like just really sign up for that newsletter. I know updates are have been infrequent lately, but I imagine that that's going to start to pick up. So if you are interested in any capacity, please sign up for that. That's going to be the best way to get the up-to-date information, and that always has a place on our website too. If you forget to do it right now, totally understandable. And then I would also say that if you have issues signing up, please email our HICPUF CHW benefit, and I can get you signed up on the back end as well. So I really appreciate all of the excitement around this. We're excited too, and we're ready for it to be here just a little bit longer, I promise, and it'll be here before we know it. So hang tight, and we'll publish additional guidance as it becomes available. So thank you guys.
Yeah, and let me tell you what you can do while waiting for this. There's that survey that I talked about. It takes 20 minutes. So everybody, let's just keep the ball rolling. But Elena, you did a marvelous job. This is so many good things like happening, a lot of moving parts. Thank you. Morgan, you've been a fearless advocate in putting this all together. Kudos, huge lift, a lot of good things. Becky and the health department, great leaders. We're going to keep the pedal on the metal as we're discussing this. A quick reminder that the next session will really be talking about workforce development, what supports are out there, how to really look at getting your staff and your teams ready to go. And then the survey link is there again. Everyone, if you have other suggestions about topics we need to be covering, again, the fall series is about level setting, education, informing. The Alliance will be working on helping make some of these opportunities for showcasing technical assistance supports, or even more further delving into providing input around technical assistance, because these codes, this work is only as good as they get implemented. So we're here for it. Like, let's all lean into it. Super excited. Have a great day, everyone. And again, ladies from HICPUF, thank you so much for joining. Everyone have a good rest of your day and afternoon. Thank you.
Thank you all. We'll be sharing all the links and information. So if you missed a link, we'll be sending it out. So thank you all. Take care.
Bye, guys.